Constipation is super common in MS, and in this video, I'm going to share with you 11 tips to beat constipation without using a single prescription medicine. Don't turn away, because that starts right now. Hey! Howdy! Thanks for learning about MS with me, Aaron Boster. I'm the founder of the Boster Center for Multiple Sclerosis, where we see people impacted by MS from around the globe, on telemedicine and in the office. We accept all major insurance carriers and are currently enrolling multiple clinical trials. If that sounds interesting, call the number below. Today's video is an important topic, constipation. All too often, people with MS have trouble pooping, and there's a lot of reasons. First of all, the disease itself can slow down gut motility. Add on to that difficulties with remaining physically active. Add dehydration. Add medicines that can contribute to constipation. It's no wonder that people with MS can get bound up. In this video, I'm going to share with you 11 of my top tips to combat constipation without using a single prescription medicine. So let's jump in. Number 1 relates to food choices. The foods we eat have a lot to do with how easily we can move our bowels. And the reality is that a fast food lifestyle is a super way of getting yourself bound up. Foods that are high in fat and low in fiber help you be constipated. Foods that are fried and heavily processed, meals that are predominantly meat-based and lacking whole grains or fruits and vegetables bind you up. Pastas and white bread bind you up. Alcohol dehydrates you and binds you up. I need you to start this process by critically looking at what you eat. And as I am fond of saying, I encourage you to eat a whole food, real food diet. I encourage you to avoid fast food and processed foods. I encourage you to avoid fried foods. And I think that if you start on this process, you're going to learn that some of your old food choices were in fact contributing to difficulties in the bathroom. Number 2 is to up your water game. Dehydration leads to rock-hard stool that's almost impossible to pass. And we need to get you in the habit of drinking more water if we're going to make the bathroom a bit easier. Here's how I recommend doing it. For starters, I want you to drink 1 glass of water with breakfast, a glass of water with lunch, and a glass of water with dinner. Honestly, I don't think that's asking too much. Then I want you to drink 1 glass of water between breakfast and lunch, and 1 glass of water between lunch and dinner. That's it. That's going to start you on the road to upping your water game, and you're going to find a remarkable benefit when you're trying to move your bowels. Number 3 is to up your fiber game. Again, the fast food lifestyle is almost devoid of fiber, and we desperately need fiber in our diet if we're ever going to be able to move our bowels regularly. Fiber is an indigestible solid, something like sawdust. Now, don't eat sawdust, but it's an example. You put it in your mouth, it's going to come out your tush because your body can't absorb it. Now, when you have fiber and you add water, it swells like a sponge, and it helps make your stool big and soft and bulky and easy to hold on to and easy to pass. I'd like you to supplement fiber the natural way through awesome food choices. I'm talking about adding in fresh fruits and vegetables. I would encourage you to purchase prunes, apples, and pears. These fruits are super high in fiber, they have sorbitol and water. All of these things are going to help you move your bowels more easily. Cereals, specifically oatmeal, is a fantastic source of fiber, as are whole grains. Please don't buy white bread. They've removed the fiber quite literally. You want to buy whole grain bread where they've left the fiber in there. Another great source of fiber are beans. And lastly, you chocoholics will be happy to learn, dark chocolate is another good source of fiber. And so please make these whole food, real food choices to add fiber into your diet. If you find that that's not enough, and by the way, the goal is about 30 grams a day for most people, you can always go to the local supermarket. They have an aisle called I Can't Poop, and you're going to find a bunch of fiber supplements that you can pick up. Stuff like Metamucil or FiberCon, and that's another way to add fiber into your diet. But I want you to try to do it with fruits and vegetables first. Number 4 is taking a probiotic. Patient after patient has come to me reporting that it's been almost magical how after they've started probiotics, their bowels became regular. and folks that were having diarrhea or folks that were having constipation seemed to level out. Now, I have a video on probiotics, and I'll post a link up above so you can check that out. And we don't yet know which is the best probiotic, so I would encourage you to buy a bottle from a reputable source. If you wanted to go the natural route, you can eat yogurt that has probiotics in it. Either way, adding in positive gut flora is a super way of helping you move your bowels. I talk a lot about the benefits of physical activity on this channel, and it turns out that being regularly physically active helps you move your bowels. Being physically active makes your gut move and helps gut motility. And if you can find a way to exercise as part of your lifestyle, a hidden benefit will appear in the bathroom when it's easier to move your bowels. Number 6 is taking advantage of human physiology, something called the gastro-colic reflex. When you eat a meal, about 15 to 20 minutes later, your colon tries to evacuate. When you drink a hot beverage and that hot beverage hits your gut, about 15-20 minutes later, your gut tries to evacuate. And so taking advantage of that, understanding the gastro-colic reflex, you can time when you try to move your bowels. In the morning when you wake up and you have a hot beverage, about 15-20 minutes later, I want you to sit on the john and try to poop. After you eat your lunch, about 15 to 20 minutes later, is a prime opportunity to move your bowels. Take advantage of the gastro-colic reflex. Now, in the setting of MS, you might not get the feedback system that your bowels are trying to move, but I assure you that they still are. And that's the golden opportunity when you have the highest likelihood of being able to move your bowels. Remember the gastro-colic reflex and take advantage of it to successfully poop. Number 7 has to do with the bathroom setup. Don't rush yourself. Don't try to squeeze in a bowel movement with 5 minutes left to jump in your car and get to work. You're setting yourself up for failure. I just mentioned that 15 to 20 minutes after you eat a meal or drink a hot beverage, your bowels try to move. Get yourself situated in the bathroom and give yourself at least 15 minutes. Don't rush yourself. Don't strain. Let your body naturally try to move. Another pro tip is to consider a device called the squatty potty. A squatty potty is simply a stool that pulls your legs up, and it actually puts you in a much better physiologic position to be able to move your bowels. Sometimes people with MS can have weakness of the pelvic floor, and it's hard to push properly. It's hard to bear down. You'll find that if you can get yourself on the john and put your legs up on the squatty potty, you are much better positioned to be successful. Setup and giving yourself time are important tips to help you poop successfully. Number 8 is actually my favorite, coffee. Now, before you start yelling at me, oh no, coffee will dehydrate you. Not necessarily. If you're adequately hydrated, drinking water the way I mentioned earlier, coffee can be a major help for 2 reasons. Reason number 1, it's oftentimes drunk hot. And when you drink a hot beverage and that hot coffee hits your belly, it's going to trigger that gastro-colic reflex. Number 2, the caffeine in coffee is a motility stimulant, and it's going to help get your bowels moving. And so coffee is a super helpful way to get your bowels moving. If you're not a fan of coffee, hot tea will accomplish the same goal. And I encourage you to enjoy a cup of Java in the morning, and then 15 minutes later, go sit on the john. Frequently in clinic, patients will share that they're moving their bowels once a week, and that's not often enough. I really don't want you to go beyond 2 to 3 days without pooping. I want you to dictate when you poop, not when your bowels feel like it. This is called bowel training, and the goal is to create regularity. If you're working on the stuff I've mentioned thus far, and it's been 2 to 3 days and you haven't moved your bowels, it's time to help induce a bowel movement. A way to do that without medicines is digital rectal stimulation. Now, don't freak out. You're in your bathroom. It's private. You can wash your hand when you're done. Just hear me out. When you insert your finger into the rectum and then you move it in a circle, it stimulates the nerves of the rectum that sends a message up to the spinal cord, basically saying, hey, time to poop. And then your spinal cord responds by sending messages back down to start the process. Digital rectal stimulation is an excellent way of helping you induce a bowel movement. And you can piggyback off the gastro-colic reflex. So if it's day number 3 and you wake up and have your hot coffee, it hits your gut, and then a couple 15, 20 minutes later, you sit on the john, and you're there for 15 minutes, sitting with the squatty potty and not pooping, time to try digital rectal stimulation where you can induce a bowel movement. You want to help train your bowels to be regular with a goal of pooping at least every 2 to 3 days. Number 10 has to do with medications. Not medicines to help you poop, but medicines of side effects of constipation. And I'll be honest, there's a bunch of them. As I go over these medicines, if you're on one of them and you're constipated, I would encourage you to reach out to your provider to have a discussion. So let's go through a list of 8 types of medicines that are notorious for causing constipation. The first are opioid analgesics. Opiates are notorious for causing constipation. Opiates are not my favorite form of pain control in MS, and I talk about that in other videos. And if you're taking opiates on a regular basis, I'm not surprised if you're really constipated. Number 2 are non-steroidal anti-inflammatories. These are some of the most used over-the-counter medicines that exist. Things like aspirin, Aleve, Excedrin, so on and so forth. These medicines are pain relievers and they help with inflammation, and yet they can cause constipation. And if you're using them, you need to think about what you're doing to your bowels. The third category are antihistamines. These are things like Benadryl, again, commonly found over the counter and used for a myriad of reasons with a side effect of constipation. If you're taking Benadryl or other antihistamines, that may be contributing to why you're having trouble pooping. Number 4 are tricyclic antidepressants, medicines like Elavil and Pamelor. Now, neurologists commonly use these medications off-label to treat neuropathic pain. I certainly do. But we have to keep in mind the side effect of constipation. The 5th category of medicines are bladder pills, Flomax to help with retention, and other medicines like Detrol, Ditropan, Sanctura, and Myrbetriq that I use commonly to help people have better storage capacity so they're not running and sprinting to the bathroom. These medicines can be super effective in helping people control their bladder, but they can cause constipation, and we have to add that into the equation. Number 6 are iron supplements. Many people are iron deficient, and you can pick up iron supplements over the counter. Please keep in mind that iron supplements can bind you up big time. Certain blood pressure medicines can also have a side effect of constipation. Maybe the most notorious are the calcium channel blockers. These are medicines like Norvasc or Cardizem. They're used commonly, and they can really bind you up. Beta blockers like atenolol, propranolol, and metoprolol are also notorious for binding you up. Now, treating blood pressure is really important, but we want to be aware of the constipating side effects. The last category of medicine to be concerned about are anti-nausea medicines. Zofran and Phenergan are examples of excellent anti-nausea medicines that can cause constipation. Again, if you're taking any of these meds, it doesn't mean that things are horrible and there's gloom and doom. It just means that it may be contributing to why you're having trouble pooping, and I would encourage you to talk to your provider. Number 11 is my pro tip. If you're having trouble pooping, I would encourage you to seek out pelvic floor physical therapy. Pelvic floor physical therapy is amazing at helping with bowel and bladder control and sexual function for that matter. Oftentimes, people impacted by MS can have changes to their pelvic floor. They can lose sensation down there. They can develop significant weakness of the muscles of the pelvic floor, and they can have spasms and spasticity. And working with a pelvic floor physical therapist can be a profound game changer. If you'd like to learn more about bowel and bladder in the setting of multiple sclerosis, click the link that's on your screen right now. My name's Aaron Boster, and thank you for learning about MS with me. Until my next video or my next live stream, or the next time I see you at the Boster Center for Multiple Sclerosis, be safe and take care.